Welcome to Dr. Ashori. My name is Dr. Ashori. I'm a board-certified family medicine physician. I wanted to take you behind the scenes today to kind of give you an idea of how I work with my clients. So it's always different. Everybody is at a different stage in their life. Now, I am a family medicine physician, so the fact that I do health coaching is rather unique. But what I bring to it that is unique is that I have a lot of clinical insight. I know a lot about chronic diseases, chronic disease prevention, managing diseases, and I know over the years what has kept many of my patients from developing those chronic diseases. And in my health coaching, in my healthy aging health coaching, I try to bring some of those pearls, those knowledge tidbits to my clients to help them prevent those conditions. So oftentimes, somebody will find me either through my YouTube channel, on LinkedIn, or some of the ads that I run on Google and Facebook, and they land on my webpage. The first thing they see is, okay, I can book a 1-hour session or I can book a monthly coaching. Almost always they book that first 1-hour session and we kind of dive into what they have. So what's different about my health coaching is that there is no lengthy form to fill out where you enter your past medical history, your medications, your supplements, your symptoms, your diseases, because I don't treat diseases, right? There's no lengthy form to fill out anywhere. Once you book the session, we get on that call. And oftentimes it's a video call. Some people prefer an audio call. It's always different. I usually use Google Meet. I like it because it is fairly well protected. Most people are comfortable using it. Other people prefer Zoom. Others prefer WhatsApp. WhatsApp is really nice because it's so ubiquitous. And I have a lot of clients, not just in the US, but also outside of the US. So what we don't talk about in these sessions, especially that first session, is we don't talk about diseases. We talk about health goals. My intention is to find out what my client really wants to achieve. What is it that they're worried about? What are they at risk for? What are they trying to achieve? Where do they think their overall health is now? Where would they like it to be 5 years, 10, 20, 30 years from now? And so we explore that together. In that process, in that first hour, it gives my client a good impression of how I communicate, how I think through things, and oftentimes, fortunately so far, they will then go from the 1-hour session to booking an ongoing monthly session. So the ongoing monthly membership is a one-time fee they pay every month. Every month they pay a certain amount. Right now it's at $400, and we do 4 sessions a week together. So these sessions, in the beginning, I feel like they're kind of a little bit awkward because both of us are trying to get to know each other. They're trying to kind of still size me up a little bit. My clients are trying to figure out like, oh, is this guy going to like judge me for this? Is this guy really going to know much about this? And I'm trying to figure out, like, does this person really have a good idea of where they want to go? What do they want to do? So we're both still kind of getting to know each other, but it's really pleasant. Oftentimes it's funny and we're talking about things that we shared from the previous session. So it's very personal. It feels quite different than the medical practice that I run as a physician. So during these sessions, we really figure out that particular health goal that somebody has. And we then focus on where they're at now. So my goal is to figure out, where are you right now in your overall health? And what are the assets that you have? Assets that people have to me are time, resources to research clinical stuff, their health literacy. Health literacy means how much do you know about health, overall health. Just like somebody might be brilliant when it comes to cars, and they might know nothing about home construction. It's the same thing. Somebody might know nothing about health, or they might be a biohacker. So I get everyone. I get the whole spectrum. So we want to figure out where they're at right now based on what resources they have available to them so that we can then figure out, all right, what do we need to work on? What of these can we use to get you to your ideal health goal? The next thing I wrote down is to assess their overall risk. So this comes a little bit later. I often collect this kind of information asynchronously. We chat about it over a long time, right? Over many months, over many weeks. And I kind of assess, is this person at risk for dementia, diabetes, cancer, heart disease, frailty, right? These are the things that I really care about, that I'm passionate about, because I think they're preventable. So I collect that information. And then as we keep talking about their health goals, I can introduce some of that information and say, are you at all worried about dementia? Well, yeah, now that you mention it, my mom had it, my dad had it, my grandpa had it, my uncle had it. And so then we kind of dive more into that. And I work with them very closely to also involve their primary care physician, their particular healthcare provider that they have, to do some other testing. I don't necessarily suggest any kind of test. It's just I share my knowledge, the expertise that I have as a physician, and they can use that to take it back to their own doctor to make decisions or order tests if necessary. And so now we actually carve a path. And that often takes time. It takes a few sessions, but we eventually figure out a couple of goals that my client has in mind and a couple of risk factors that maybe we identified. And so now we kind of carve out a path of what should we focus on? Is it more the activity stuff? Is it more the nutrition stuff? Is it more the stress, sleep, supplements, anything? And we then identify the hurdles that this individual has. What is it that makes it difficult for you to see yourself getting to this ideal health goal, health endpoint? Well, there's no such thing as an endpoint, but this ideal health goal. And can you envision yourself actually being a super healthy 80, 90-year-old or 70, 60-year-old, whatever your vision of health is? And I help them get there. I help them kind of clear out all the fuzz and cloudy judgments that they might have about themselves or misunderstandings they have about Western medicine and health and science in general. And we sort of get down to the truth, down to the nitty-gritty. Finally, when it comes to actual communication, to actual connection, look, it's everything. I text some people, quite a few people. We just sort of do back and forth voice messages on WhatsApp. So we're just constantly connecting and talking and leaving lengthy audio messages. That seems to work really good for some people. Texting works better for others. But usually the main way that I connect with my clients is once a week. We book a time, both of us hop on an audio call. And these days we actually do it just walking, which has been super, super fun. So we both go for a walk. So it's an activity, it's an exercise. Some of my clients are on their elliptical when they do it. Some are on their bicycle. We don't do much video. The reason is it forces you to be sedentary. It forces you to be in this kind of awkward, stiff position with your neck. And so most of my clients don't like that. And we share a lot of data back and forth. That's the great thing about asynchronous communication, text-based, email-based communication, because I can send them good articles, they can send me some things that they saw, and then we kind of dissect it together. So that's behind the scenes. That's the way we work here at drashori.com. I hope it's helpful, and have a great day.